Episodic future thinking in connection with the treatment of risky behavior. A technique has been developed that can reduce the number of impulsive decisions that we make. It is known as episodic foresight. There is a very wide range of risky behavior, e.g., smoking, drinking, practicing certain sports, or a stressful job. They can lead to heart attacks, cancer, and respiratory problems. In fact, risky behavior refers to events that we tend to mentally try to escape from because their presence creates danger for us. Death. How does episodic future thinking come into play? Preventing these events via healthier habits, behavior, and lifestyle is one of the goals of health science and especially psychology. In this context, recent research reported in papers del PSIC or ELOGO analyzed how episodic future thinking affects the avoidance of risky behavior. Answer et al. 2022. Keeping the body healthy is a duty. Otherwise we will not be able to keep our mind strong and clear. Buddha. Risky behavior, an explanation from behavioral economics. People who engage in risky behavior are often aware of its effects. Andrew, age 21, is, for example, a young cannabis user. He is aware that this drug is a real Russian roulette for the development of various clinical conditions such as depression or psychosis. However, Andrew continues to consume cannabis. Why does he do that? In fact, there are various factors involved in maintaining unhealthy habits. For example, impulsivity. This refers to a type of unplanned and extraordinarily automatic behavior. Matjorska et al. 2016. We can judge Andrew's decision is irrational. This is suggested by the theory of behavioral economics. It argues that our behavior is significantly influenced by both the environment, i.e. context, laws, policies, and culture, and how reinforcing the stimulus, in this case cannabis, is. When the mentioned factors are combined, impulsivity and reinforcing value, it results in a dangerous cocktail. In this connection, treatments are being developed whose purpose is to reduce decisions that gravitate around impulsivity. Rotz et al. 2020. Thus, intervention, based on episodic future thinking has attracted the attention of researchers. Risk-taking behavior can be understood as a choice disorder characterized by two processes: an exaggerated assessment of the reinforcer and impulsive decision-making. Albabjek and Rotz. Episodic future thinking. Episodic future thinking, hereafter refers to people's ability to create in their imaginations scenes of future events that can affect them. Deficiencies in this ability are closely linked to diseases such as obesity, depression or anxiety symptoms. Chayat al. 2022. EFT is considered a treatment technique. From a cognitive perspective, the person is trained to describe and visualize themselves in a future situation. One of the fruits of this training is that they improve their decision-making processes. Furthermore, EFT contributes to the individual considering the reinforcing value of other stimuli. These are medium and long-term reinforcers, without pleasant effects in the present, e.g. to exercise or to include fruit and vegetables in the diet. However, these reinforcers may potentially be more pleasurable than risky behaviors, such as smoking, overeating, or alcohol consumption. Episodic future thinking has been studied as a psychological intervention aimed at people suffering from obesity to reduce the consumption of high-calorie foods and promote decision-making. Tinuk Aluiomi Daniel. How EFT helps prevent risky behavior. In the consultation, the therapist prompts EFT by guiding the patients to project themselves into future situations. They achieve this by asking them questions that involve describing the time, place, how the event occurs, and who is present. The more real and vivid the imagined situation, the better the person will develop their EFT. For this purpose, they use short sentences. For example, Andrew can verbalize that in 3 days I'm going out climbing with my girlfriend. He writes it down and visualizes this situation for a few minutes. After this exercise, he must access the characteristics of his mental projection into the future. He must ask himself if it was realistic and if the picture he created in his mind was alive. Then the therapist asks him questions like, did you have fun? Did you feel comfortable? How important was it to you not to use cannabis? It is health that is the real wealth and not gold and silver pieces. Mahatma Gandhi. As episodic forward-thinking effective in preventing risky behavior. EFT is a good intervention strategy for reducing delinquent behavior. There are e.g. reported clinical benefits in substance use, Voss et al. 2022, and in care behaviors related to diabetic disease, Epstein et al. 2022. EFT is able to potentially reduce the decisions that individuals sometimes make as a result of impulsivity. It is configured as a useful tool in various contexts, such as obesity and promotion of physical exercise. Furthermore, it is useful as an isolated technique. Alternatively, it can be introduced into broader treatment protocols, such as cognitive behavioral therapy, increasing its benefits. As you can see, EFT has extraordinary power when it comes to preventing risky behavior. In fact, it is expected that over time it will become an important resource in any healthcare professional's arsenal. This technique shows promising results in reducing impulsive decision-making and increasing health-related behaviors. Gemma and Diego.